Hello, this talk is about the current hot topic COVID-19, but there's a slight change. This is meant for pregnant women, patients who are taking fertility treatment, and children. So, this is a special sector because the immunological response in these patients, their immunity is very low, and therefore they are in a very critical situation where they would be affected very quickly if they are exposed to the virus. And all these patients, dietary advice, take lots of fruits, lots of vegetables, and lots of fruits and nuts because they should develop their own natural immunity. So this is very important, and all pregnant women, they are taking their own vitamins and calcium and minerals. So all these have to be strictly continued. If children have been given some vitamin drops, they can continue that as well. Food is very, very important, and though we have said that lots of fruits, vegetables, non-vegetarian can also be taken, mutton, chicken, fish, everything can be taken, but most important is how to handle the food, how to cook the food, and how to serve the food. So handling is very, very important. Anything that you get from outside has to be washed many times before you get it into the house. And the second thing is, the person who is doing the cooking should also be very, very clean, take a nice bath, and wash many times her hands and also the vegetables and fruits many times before you cut it and use it for cooking. And when serving the food, it's very important that they wash their hands, wash the plates well, and then serve the food, preferably hot food, so that the spread of virus is minimized. And the same rules apply for children as well. So once the diet part is over, we know that all vitamins have to be continued, and all the general trend at home is the distancing. So this is very, very important because this is self-protection. Any person who comes from outside, they have to wash themselves well, they have to have a proper bath and wash their hands well before they come into the house. This is very important because there are pregnant ladies and children at home. So this point should be noted very carefully. And once they are, even if they have had their bath, it's very important to maintain a certain level of distance, because still, the respiratory tract, they are still breathing, and the breath is the one which carries the virus. So still distancing is very important. And it's better that once somebody gets a cold in the house, it's better that they isolate themselves, because we don't know what sort of cold it is, whether it's a virus, and if they have more symptoms, then they should get themselves tested and isolate themselves. Now the next important thing is how to manage the pregnancy period. Many of them are in different stages of pregnancy. It could be 2 months, 3 months, 6 months, 8 months, close to labor. So whatever the period of pregnancy is, their vitamins, minerals, calcium should be continued, and they should get adequate stocks of these medicines. And their next checkup is already decided by the doctor. But if it is not a very important checkup, they can just call and find out whether it's important, or they can defer the checkup by another 2 or 3 weeks. But the 12-week scan is very important, and maybe 2 weeks you can adjust, but it's very, very important because it is all calculations are done for that period of pregnancy. So that date alone should be maintained, and they should go for their regular checkup at that time. The same way, the 20th week scan is also important, but all the other scans, it can be this way or that way. But once the doctor tells you that already the baby is small and the blood flow is a little disturbed, or they have high blood pressure, diabetes, or any other medical complications of pregnancy, they should go for their checkups regularly as decided by the doctor. So this is about the medical checkups in pregnancy. Now what happens if a patient has pain? So they should report to the hospital immediately, and many hospitals are geared up to tackle this situation, and Prashant Hospital is one of them. We have been totally trained in managing this situation. So if they come, emergency is open 24 hours, so they can have their checkup. Then we decide whether it's labor pain or not, and if it is not labor pain, keep them under observation for a day and then send them home. If it is labor, then we have to learn to handle labor. We've all been trained. The personal protective equipment is available with everybody. We have to use this equipment when we are conducting a delivery, and either normal delivery or a cesarean, we are all geared to handle this situation. We have been trained adequately, and most important of all is there is not much information about the coronavirus and delivery, because not many deliveries have happened. There are a few deliveries which have happened, and we've seen videos of that, so we know exactly how to manage this patient. So once the delivery is over, if it is a positive patient, then they should be maintained in the intensive care unit. If it is a patient with symptoms and they've just given their test, they should be maintained in intensive care till the test reports come. Once it is the reports are there and it is negative, then they should still be in isolation, because there are many instances where symptoms come, the first test is negative but a later test may be positive, so they should be in isolation till their symptoms disappear and the next test comes in as negative. So this is very, very important to protect themselves. Like I told you, they are already immunocompromised, and after delivery they're still more immunocompromised. So you should be really careful in handling these patients. The baby also should be in isolation and treated carefully, because the baby also, and the blood is taken to check the corona status of the baby as well. So during pregnancy, and if you are pregnant, don't get worried at all. There are enough instructions given to you. Follow the instructions strictly, adhere to all these principles, and if you have back pain, stomach pain, bleeding, watery discharge, report to the hospital immediately. Baby's movements are also important. If they are low, report immediately. And once you are in labor, we have enough and adequate measures to protect you and carry you safely through labor and deliver your baby, and you can be rest assured that everything will go on well, and we just advise you to follow all the principles and advice that have been given to you.